Michael and I were good citizens. We followed what we thought we were given to be the right thing to do for our elderly people in our lives and young people in our lives, that we needed to have the vaccine. And we did the right thing, that we thought. And it just feels like chair. And then from the wheelchair into the bed. And now from the bed, it used to be, he'd do all the exercises and everything. And now he lays there. And honestly, that's the thing that is for me every day, every time that I see him, is how still he is. Mm-hmm. And he was never a still man. He moved. He loved, motion, as we talked about with, his own walk across Canada and that, right? I didn't know him then, but, so he's just so still now.
I'm Tamara Ugolini for Rebel News here in Hamilton, Ontario. And behind me is the Zoetic Theatre, where the documentary Why Can't We Talk About This is being screened. It details the severe health decline of Michael Osh, who's a 59-year-old man from Waterford, Ontario, following his fourth modified RNA COVID-19 vaccine roughly 2+ years ago. Now, I did visit Michael Osh in his long-term care home prior to coming down to this theater, so you can find that in a separate report. And I'm going to see what some of the attendees have to say about the phenomenon of COVID-19 vaccine injury and what they think of this documentary. So stay tuned while we go check it out. And so why was it important for you to be here tonight?
Well, I've been advised Michael as a friend, and was invited by a friend to come and see him about 4 months ago, learned of his plight, learned of his medical history, and shortly after learning about it, was invited to participate in the film about Michael and his injury. Mm-hmm. And it's really a dramatic and a terribly sad story.
It's important for all of us to support all the important work that's going on. There are a lot of really great groups and really great people, such as my friend Dr. Speaker, who has a document called To Halt 19.com or .ca rather. Everybody asks, where's your evidence for the things you say? And when I came across this daylight.ca a couple of years ago, being a marketer, I recognized the brilliance in the domain name.
Because we need to talk about this. I mean, this is still the elephant in the room, that it's getting better. I am seeing a shift. More people are recognizing and more people are willing. However, there are institutions that still need to be broken through, and these conversations need to be had, and to ultimately, these shots need to be pulled.
Mm-hmm. I'm here with Saskia, who's Michael's wife. And so from your perspective, as this documentary unfolded and the screenings are happening, what have things been like from your point of view?
Well, for one thing, the documentary itself was quite shocking for me to see, because from January of 2024 to now, there's been such a decline. And I just said to Stephen that it's strange seeing him vertical, because he's not vertical anymore, right? Unless he's in the wheelchair, and then it's laying down kind of thing. So, and it brought to mind as well the struggles that I had to try and take care of him while trying to work as well at the same time. What really struck me when I was watching the documentary is the fact that, when the Pumpkin Fest, the day after he had the vaccine, and I remember him walking in front of us towards the fireworks going, your leg is dragging, like you look almost like a drunken sailor or something. And I remember that. And then, so just to picture, he started with, awkward gait, and then it progressed to a cane. And then it progressed to my 2 walking sticks, because we didn't really have anything else. So it was walking sticks. And then after that, it was a rolling walker. And we were like, okay, well, it can't get much worse than that. And then eventually it became a stationary walker because he just couldn't stand up anymore on his own. And then it became the wheelchair. And then from the wheelchair into the bed. And now from the bed, it used to be, he'd do all the exercises and everything. And now he lays there. And honestly, that's the thing that is for me every day, every time that I see him, is how still he is. And he was never a still man. He moved. He loved, motion, as we talked about with, his own walk across Canada and that, right? I didn't know him then, but, so he's just so still now.
What is the update in your case?
Well, I think at this point I'm on case manager number 4 for the Vaccine Injury Support Program. Even up until about 3 months ago, I was still being requested to submit further paperwork. They were up to now wanting to know what my health status was in the 5 years prior to the injury. So it's been one thing after, and then turning into battling with my own doctor's office, because they were then demanding me to pay for the submissions of my paperwork to the Vaccine Injury Support Program. Wow. I did end up getting that sorted out, but the lack of communication, and again, it's, you can only expect to hear from them quarterly, which they wholeheartedly admit, and if you even hear that much from them, it's surprising. I did just recently get notice that they feel they have all the documentation that they need, and finally, yes, and it's going to be going to the medical review board next month, from what I understand, and they will let me know what the report says.
So you did not receive the gift of informed consent. That's what I want to share with everybody. We are finding, as we get freedom of information requests and information is being uncovered all over the place, that our health regulators lied and covered up information. And I kid you not.
Each consecutive shot that they receive exacerbates the chances of having an adverse event. Can you touch on that?
Well, it certainly can do. The more shots, the worse. As they showed in the Cleveland Clinic study, the more vaccines that the staff of the Cleveland Clinic received, the more they were off ill, the more they had COVID, the more times in ICU, the more they were dramatically ill per shot. And the 4th and 5th, the people who had 4 and 5 shots, were massively ill on the graph, and the people who got no jabs at all were fine. So basically, yes, you're absolutely right, that the more jabs you take in this lottery of COVID shots into your arm, the greater risk you have over time.
Do you have a message maybe for Health Canada, politicians, those that kind of continue to fail to recognize vaccine injury and fail to uphold the support that's supposed to be in place, like the VISP program for vaccine injured individuals?
What I would like to say is that Michael and I were good citizens. We followed what we thought we were given to be the right thing to do for our elderly people in our lives and young people in our lives, that we needed to have the vaccine. And we did the right thing, that we thought. And it just feels like we were, we were let down, and that somehow there's nothing in place for people like Michael and others, and those that care for them and care about them. And, that's the thing. We were good citizens. We followed the rules. We thought we were following the right things. And, it just, that's the part that really upsets me, is that the Vaccine Injury Support Program, what the hoops we've had to jump through to even get to the part where they are saying, well, now we will start to process your claim and determine whether or not it was actually vaccine related. And to me, it's just like, wow, that's sad.
When you say in the context just of they lied, who's they?
Oh, well, I'm glad you asked that, Tamara, because there is a link right on the website that asks that question. And when you click on there, they explain who they is. And it's not just one they. It's a multitude of these. We have many institutions who have lied to the people. We have government bodies that have lied to the people, media, mainstream media. Without their lies, none of this could have been perpetrated to this level.
Just as we see the shift in policy and restriction of these shots happening in the United States, where they're now, not recommended any longer for basically anyone healthy under the age of 65, and specifically pregnant women and healthy children. And yet here in Canada, it seems like our health bureaucrats are doubling down. So why the disconnect there?
Well, those words were from Health and Human Services Secretary Kennedy. He's being opposed within the United States by the bureaucracy. So it's really not on paper or online any different than it was 3 months ago. He's wanting it to go that way. He's not getting agreement within the FDA and CDC so far. But he will get there. He will get there. And we applaud him doing so. And that's my only comment about that. Hopefully Canada will fall in. Canada will be a good 6 to 12 months behind the US of A, because guess what? That's what we just do here in Canada.
I mean, we have some brilliant researchers here who can speak to this, who can provide evidence to the harms that these injections are causing. And I don't know. I mean, you can speculate, you can theorize as to what it is. The science is not different. It's a simple line in the sand does not change that. I don't know if it's even deeper infiltrations into our institutions. I don't know if the pressures are different here. It's astounding. It really is astounding that at this point you have professionals who can look at this and ignore the facts that are in your face.
What do you wish more Canadians or the general public knew about vaccine injury, and especially as the family members navigating someone they love with vaccine injury?
I think one of the things that, maybe even this documentary doesn't quite tell, but I understand why, because you can go down a rabbit hole, but it's the ripple effect of being vaccine injured, and the woman that's almost blind, and how irrevocably her life has changed, but also how irrevocably our lives, the ones that love the people that have been injured by the vaccine, how our lives have changed. Like I was just saying to someone, we had planned on going to Iceland in 2023 and saved up, and we were going again, and that will literally never happen. And so my own path, where I was supposed to be going with Michael, it's not there anymore. And to reconcile not only the fact that my husband is no longer living with me, and to reconcile that, I go and see him twice a week at least, and I don't know if time's running out, but I'm pretty sure it is. And it's, that's not what I thought our future was going to be.
The shot that damaged Michael, the shot that gave him transverse myelitis, which means inflammation of the nerves that cross the spinal cord and are related to going to your muscles, that happened in October of 2022. I stood on a street corner in Toronto, as you well know, stating that the shots were and stating that Denmark in September of 2022 had removed giving shots to anyone under the age of 18. Another month later, they removed it for anyone under 50 getting the jabs. So if one international country like that can realize the toxicity, the danger, and the damage, and the totality of effect on your neurologic system, why are we 3 years later only getting to it now in France and Canada and the US and Australia? We're getting at it terribly slowly and with a lot of harm. And if dear Michael had maybe heard that speech that I gave, or my interview that I gave to you in the summer of 2022, stating the concerns, stating the interest, the kind of thing that no major media were doing. You were doing it, but major media were not doing it, and it prevented society, and it prevented Michael from perhaps developing a question in his mind and perhaps skipping that fourth jab. And if he had skipped that fourth jab, he would be a man who could still walk across Canada today. But now he can only walk a yard or two or less because of neurologic damage to his body by vaccine injury.
If you'd like to find more reports just like this one and support this kind of work, please do so at nomoreshots.ca. That's nomoreshots.ca.